Okay, so good morning everyone. Today it's a really exciting day because as you know, normally when we're hair transplant surgeons, we're by ourselves. But today I have my lovely colleague and very good friend, Dr. Joseph MacDonald from Calgary. And we have been doing the case today together, which has been a really fun morning. So we thought we'd take this opportunity to have a little Q&A, have a little chat about what we often get asked about different techniques and sort of share our opinions. I think for myself, what's really wonderful about these opportunities is we get to actually learn little, snippets of information. You're always learning, and I've certainly learned lots of cool things when I went to Calgary a couple of weeks ago, and today Joseph popped over to see me.
Well, thank you for having me.
No, of course.
It's been wonderful being here, and a very gracious host. Dr. Sharma is one of the best in the field, that's for sure.
He's too kind, as is he. So we were actually in the kitchen today, and we were having some coffee and some chocolates and tea, and we were talking about follicular units excision and what it is, advantages, disadvantages, and also some sort of quirks about the procedure as well.
So I guess for anyone watching, a little bit of definitions here. What is FUE compared to FUT? These are the two acronyms a lot of our patients will see when they do any research on hair transplantation. Sometimes it's a bit hard to differentiate the two. So how would you describe, I guess, FUT versus FUE really simply?
I think they're both techniques in how we extract the graft from the donor zone. FUT is the classical strip cuts, where the surgeon's taking a very fine strip from the back of the scalp. It's linear, and then you're stitching the scalp back together. And then this piece of scalp, you're actually dissecting it under direct vision under a microscope into the individual follicular units. And with the follicular unit excision technique, it's another format of getting the grafts out from the back, but this time you're working over a wider, larger area, and you're actually taking the individual grafts out one by one using a very small circular blade, 0.9 millimeters, 1 millimeter, 0.8 millimeter, depending on the patient's scalp. So I think really it's about getting grafts out from the donor area, and I think the key component that I always like to stress to patients, it doesn't matter what technique you use, as long as the surgeon is competent, has good skills, and he has a very good team of staff around him. Because the number one thing is you want to get the grafts out intact, handled, with minimal intervention, and most importantly, for them to survive. And to, that's what's going to give you a very, very good result.
They're so delicate, aren't they?
Yeah,
right?
yeah.
And they really do need to be handled with the utmost of care.
Yeah. They're very, very precious, as we often call them, our babies, because in the morning, no matter what technique you do, we really, really take our time in, making sure we're very diligent, and we take care of all the steps. And that's why it's so important for both of us that we have the best team around us, and we do. And that's what I think allows us to be very confident that we are going to deliver very good work, because we have excellent technicians, nurses, staff members who treat the grafts with the utmost care. I guess one question I had for you was, because in your clinic, obviously you guys do, sort of a lot of FUE, a lot of FUT, and a lot of other really, really cool stuff. But I think just for our viewers, a very important question I often get is this misconception that FUE, there's no scar, it's the newer, sexier version of surgery. And I think a lot of this has actually been, almost romanticized by, the whole let's go abroad and let's go and do 16,000 grafts in 30 minutes. And
there's a huge marketing machine
Yeah.
behind the FUE movement. It's not that FUE is bad in any way, but you're totally right. It's exploded in popularity over the last decade or so by a lot of clinics overseas, and it's marketed as the latest and greatest. If you really go back in the history of FUE, this is actually a very old technology, right? Old punch grafting, from back in the day was really the same technique, although the punch size has shrunk considerably in recent years. So scarring is a lot better than it was back then, but it still yields scar. And that's one of the most common misconceptions. When you ever hear scarless or painless or anything like that, that is not, I guess, an accurate description of what you're actually left with after a surgery. Every time you excise tissue, it will leave a scar, full stop, period.
Yeah, absolutely. I couldn't agree more. I think, there's a very old saying that choose your poison. You're going to have some poison. And the fact is, if you're going to make an omelette, you have to break the eggs. So with any type of surgery, if you're cutting, you're going to leave some scarring. I think with FUE, you're actually going to have more volumetric scarring if you actually measure the surface area, because you're cutting the scalp more times than FUT. The only difference is if it's done well, you can tolerate a shorter haircut, maybe a clipper, a 2 or a 1, because the existing hair will almost cover these little white dots. Whereas with FUT, if you wear a number 3 like myself, you would never ever realize anything. I've seen Joseph scars. I mean, I would have to really be this close to see them because they're excellent. So it really just sort of depends upon, how the surgery's done. But I think it's really, really sad that things are marketed as no scarring, no pain,
not invasive.
Yeah. Or
all these terms that
sapphire blades, magic carpet blades. It's because honestly, it's surgery. There's only so many ways you can skin the cat.
Yes. Yeah.
And if you do things well, there's a system, you understand, it's all just about being informed. So I hope these videos help our clients and, our viewers, no matter where you are, just sort of make more informed decisions about going into your consultation, just having these, sort of gimbits of information. So you're going in there not sort of having the wall pulled over your eyes.
Right. They're both great harvesting techniques. They both get the job done. And at the end of the day, you're still left with the same follicular units, and that's what we're planting. One technique might better appeal to one, and maybe one is better suited towards another. And actually, to your point about scarring, that's one of the biggest differences between the two, is what type of scar do you want to be left with at the end of the day? If you enjoy very short hairstyles, a number 1 guard, a number 2 guard, then FUE really does shine in those areas. You can get away with those shorter hairstyles with an FUE, and I'd say that's probably one of the biggest single advantages that I can think of with an FUE surgery. If, like you said, you're number 3 or number 4 guard, that's more than enough hair length to cover any scar. All right, so if you are afraid of the linear scar, again, you do have to compromise a little bit with your future hairstyle, whereas FUE, you can get away with those shorter hairstyles.
Mm-hmm. And I also think it's sometimes important to think outside the box. Sometimes we have cases of very aggressive hair loss in very young patients. And I know for a fact that they will need 3 surgeries over the next 7 years to accomplish their goals. Not because, it's what I want, it's because what their scalp actually dictates in terms of their expectations. And I think sometimes with these type of patients, it's nice to combine both of them. Right. So oftentimes I will advise them to do a strip for the very, very first one, because we want to preserve as much donor virgin area as we can. Yeah. Maybe another strip, and then we revert to an FUE at the very, very end. I think that's a way smarter way of doing it than just sort of, doing 3 sessions of FUE.
Because what happens after 3 sessions of FUE? How's the donor look?
Well, it's difficult, and I always tell patients this, you're going to have patchy hair, it's going to be sparse, and I think they would be far better served by having a session of FUT or 2 sessions of FUT and then reverting to FUE. I think the bottom line is always sort of think about the next 10 years. When you're going for your consultation or you're having your surgery done, don't just think about the next year or 2 years. Because often our patients, they're very vulnerable. They come to us because they feel vulnerable or insecure about some aspect of how they look and how they feel. It's about how they feel, actually. And I think we often, we're humans, we're a species of very short-term, insight. But I think about the next 5 to 10 years. And then you want to think, well, how am I going to look? What are the outcomes going to be? So I often think if you're going to require 3 surgeries, better to do 1 FUT or 2 FUTs and then go to the FUE and have way better results. However, due to the sort of social media world that we live in, FUE is, the number 1 choice. And a lot of my patients will still say, no, I still want to have the FUE done. But I just think it's important to be informed and have this in the back of your mind, really. Yeah.
You bring up a good point. If you're going to need a high number of grafts in your lifetime, what is the best plan surgically to accomplish that goal in the long term? Because it's never a one and done, okay? We're going to need multiple surgeries over multiple decades. And so, if you look at your family history, your father's bald, your grandfather's bald, your uncles are bald, everyone is completely bald. You're going to probably head in the same direction. You're going to need a lot of grafts in your future. And so how can we harvest the maximum number of grafts in one's lifetime? It's a combination of the 2 techniques. Which one's better to start with? Well, I would agree with you. I think if we know that you're going to need a lot of sessions, better to start with FUT. And then convert to FUE. All FUT will eventually end in FUE, and vice versa. All FUE will eventually end in FUT if you need more grafts.
Absolutely. That's a very, very important point that you touched on. One thing that I've been doing in my practice is, especially some of the younger patients, they just adamant they want FUE. And I think if you come to a good surgeon, you'll sit down, you'll make a plan, and you'll operate around the future you in 10 years, 15 years. And what I will often do is I will tell them to do a smaller conservative surgery for FUE the very first time if they're absolutely fixated on that. And I will leave large virgin areas of scalp absolutely untouched. So we'll measure the donor area, we'll do a very finite area, and then outside of that we'll plan virgin areas which have not been touched for year 3 or year 5 or year 2. And that way, even if they move to New York or London or wherever their life takes them, they can tell the surgeon, my first surgeon has left me with virgin strips. And that's something I really, really dislike when some patients come to me from other centers, is there's been no respect for the future scalp. They've taken the grafts from everywhere where they could have been a lot neater, a lot more concise. Because let's be honest, once you've been operated on, getting back into that tissue is more difficult. Absolutely. The grafts are going to be of poorer quality, the healing is going to be worse. And these are the things to really be thinking about before we get to, the second surgery, third surgery.
Yeah. And I'm not sure if this ever happens to you, but I have young patients come to my office all the time, and they're only thinking about the next 5 years.
Yeah.
And they want it done now, and they want it done, big and aggressive. And they say, well, don't worry, I won't care when I'm 30 years old. If you're 30, you'll still care about your hair. And of course, there's some 30-year-olds that come in and go, well, don't worry, I won't care when I'm 40. Trust me, you'll care when you're 40. You'll care when you're 50. I've done transplants in gentlemen up into their 80s before. It matters at every age. So it's not a short-term thing. A good surgeon is going to look at you, look at your future balding, and come up with a roadmap that's going to be sustainable until the day you die. We want this to look good and stand the test of time and age well with you as you do mature into those later years.
Absolutely. Do you sometimes find that you see patients and if they do have these very unrealistic expectations and they want, everything for the next year, they don't care about your caution or your advice. How do you manage this? Because personally, I normally tell them that I'm not happy to operate on them because I put a lot of energy into my work. I only want to operate twice a week. And I've almost grown to a practice where I'm very selective about who I take on. Not because I'm a snob or I'm, above anybody. I'm not. I'm very, very humble, but I do believe if it's your work and your energy and this is my masterpiece, I want to be very selective in how I take on my work and which projects, because this isn't like cardiac surgery or orthopedics. This is an elective procedure.
Yes.
Patients are not sick. They're not going to be harmed if they don't do the surgery. But I think sometimes we can cause more harm by just picking the wrong type of patients, the ones who are psychologically not fit, have very unrealistic expectations, or finally are not going to follow the plan.
Yes.
Because at some point you have to sort of decide that, if you want to have hair, there are certain things like medications and committing to surgery and things you have to do.
You just have to do it.
How do
It's
you
maintenance.
deal with this?
Well, I think it's a mark of a good surgeon. If they're not an ideal candidate, or not even, if they could be a good candidate, a mediocre candidate, a very poor candidate. I think at some point you have to draw a line in the sand and say no. The mark of a good surgeon will be someone who can tell you no. And that might not be what you want to hear, it might not be up to your expectations, but it will be the right decision for you. If you're hearing no from a hair transplant surgeon, really take that to heart. There are reasons behind that maybe you don't fully comprehend, but you really should trust that they're looking out for your good. And I think that if they don't, there is going to be a reckoning. And I think we're starting to see that now. People who had a transplant 10 years ago, they really shouldn't have. We would have never done a transplant on them. They're coming back, they're 10 years older now. It looks bizarre, it looks unnatural. They've experienced tremendous balding around that recipient area. And it's very challenging to fix that. In some cases, you just can't. And what have you done? You've basically shot yourself in the foot, and you'll be regretting this decision to have a hair transplant for the rest of your life. And that is not what should happen with a hair transplant. This should be one of the best decisions you ever do make in your life. So I'm not afraid to tell people no, or tell people wait, right? What makes a good candidate? Obviously, they need to have good donor hair and the right kind of pattern of balding. They need to have realistic expectations. I can't stress that enough. But timing is also crucial. Okay, can you be too young for a hair transplant? In my opinion, yes.